Hey there, welcome. I'm Dr. Tingle, and I see we have you in for a cranial nerve exam today. So please come on in, have a seat, and I'm just going to go over what the exam entails. We are going to do a very short questionnaire with you, take some vitals, and then get right into our exam, all right? All right. So today's cranial nerve exam will be examining your senses. That will be your sense of taste, your sense of smell, your sense of sight, your sense of hearing and sound, and lastly, your sense of touch, touch, touch. All right. This exam will be completely painless and should be very, very relaxing for you. So, I would just like to get some basic information from you, and then we will get into the examination, okay? All right. So, can you just confirm your name and date of birth for me? Thank you. And your address. Good. All right. And have you noticed any medical changes to your health in the last 12 months? No? Good. And have you been prescribed or are you taking any new medications? Okay, good. And how about that drug and alcohol use? No judgment here, but for your health records, we do need to know. All right, that's fine. Every once in a while is okay. All right, and aside from those few questions, anything else I should know today before we begin our exam? Are you experiencing any pain anywhere? Are you having any kind of signs of depression or anxiety? All right, good. All right. And have you received any injuries or had any serious medical incidents in the last 12 months? No? Good. And have you been having any trouble sleeping? Loss of appetite, feelings of self harm, anxiety, depression, anxiousness, stress? A little bit of stress, okay. And has that been impacting your sleep at all? I see. All right, well, during my exam today, I'll look and see if I find anything that might be impacting your ability to sleep. And if I do, we can always refer you to our sleep specialists and get you in for a very, very relaxing sleep examination, which will absolutely help you sleep. All right, so I'm just going to mark this down real quick in your chart here. Our EMR system. Good. Great. All right. So now we are going to begin our cranial nerve exam. I'm just going to slip on a pair of gloves real quick because during this exam I'm going to have to be getting very close to you and we'll have to be touching you on different parts of your face, your neck, and your scalp. So, just going to slip these on real quick, just like that. It's an old trick. Helps to just open the glove up. All right. So, to begin the exam, I'm just going to do a visual inspection of you. So, I'm going to get very close and I'm just going to come up here and look at your scalp real quick. Just going to look at your scalp. Just looking for any bumps, lumps, bruises, anything like that. Just want to make sure that everything looks good. You have a very nice scalp. I'm not seeing any kinds of signs of dandruff or dry skin, which is great. Alright, well, the scalp looks good. I'm just going to do a visual inspection of your ears here. I hope you don't mind, but I'm going to have to just touch your ears real quick. Just to inspect. I'm just going to get them a little squeeze and just gently palpate around your ear. I will be a little more thorough later, but I just want to make sure that I'm not seeing any obvious signs of damage. But this ear's looking very good. Alright, same thing over here. Just gently palpating. Good. Good. Alright. Very good. Wonderful. So now I'm going to examine your forehead real quick. If you'd like to close your eyes, feel free. Just going to gently just touch and palpate on your forehead here. Good. Good. And we're going to move to your temples. So I'm just going to palpate on your temples. You let me know if you feel any pain. Any pain. Good. 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 Very good. Alright. I'm going to just palpate your eyebrows. Can you let me know if you feel any pain? Just gonna press. Good. Press. Good. Press. Good. Good. And moving to your T-zone here. Just going to run my fingers gently down, down the sides, down the sides, down the sides. And then we're going to just gently palpate under your sinuses, just like so, just like so, just like so. I'm just going to press and push out. I'm just going to press, push out, just press, push out, press, push out, press, push out. Good. Any pain? Alright. And just going to gently feel your cheek here. Just looking for any kinds of signs of swelling. Good. Also inspecting the skin. Just making sure I'm not seeing any kind of moles or lesions. Anything to be concerned about, but if we do find anything, I can always refer you to our on-staff dermatologist, who's wonderful, because we offer full, complete medical care here at the Tingle Medical Center. Alright, so I'm going to move down to your neck area down here. Just hold still for me. Good. Just hold still. Alright. Just going to feel around your jaw a little bit. We're going to come back to this later, but I'm just looking for anything obvious. Good. I'm just going to come over here, feel around your neck. Just feeling those muscles a little tight. You ever go in for a chiropractor adjustment? I can help fix that. Can give you a referral there if you'd like. Alright. So now we are going to get into doing some tests. We are first going to test your sense of taste. And this is very easy and very quick. So first, I'd like to know, have you noticed any changes in your sense of taste in the last 6 months? Okay, good. And have you ever noticed that you can taste something that others cannot taste? Okay, good. And have you ever been able to not taste something that others can taste? Good. And have you ever tasted something that you know the taste of, but it doesn't taste as it should? Like, let's say, your favorite lollipop or candy bar that you've eaten multiple times. Okay, good. Then this should be very, very easy. So what we're going to do is I'm going to ask you to close those eyes for me. And I'm going to just drop a little drop of liquid on your tongue. And you tell me what you taste, alright? So keep those eyes closed. I have my dropper. And 1, 2, 3, drop. And what do you taste? Lemon. Very good. All right. And now I have another dropper bottle here with another liquid. And I want you to tell me what you can taste in this one. So keep that tongue out. And 1, 2, 3, drop. What do you taste there? Coffee. Very good. All right. You can open your eyes now. I told you. Very quick. Very easy. And now we're going to move on to your nose. So, like before with your sense of taste, have you had any issues with your sense of smell in the last 6 months? Okay. Have you noticed any smells that others could not? Good. And have you not noticed smells that others could? Very good. This should be very simple. So to start, I'm going to ask you to just occlude your nostril like this and just breathe in gently. Good. And on the other side, same thing. Breathe in gently. Good. All right. So I'm going to have you close those eyes again for me. And I am going to have you take a smell of this. And you let me know what you smell. Lavender, very good. And very specific. It's a great sign. All right, one more. You let me know what you smell. Cinnamon, great. All right, go ahead and open your eyes. Your sense of taste and smell are perfectly intact. So now we are going to move on to testing your hearing. To begin, I am going to do another outside visual inspection, but this time I am going to use this small, very dull acupressure tool to just gently press and wiggle on different points of your ear. And I want you to let me know if you feel any pain, okay? All right. And if you'd like to close those eyes, feel free. I'm just going to come over to this ear here and just again inspect the outside. Gently palpating all the way around. Good. Good. And now I'm just going to press and wiggle. Press and wiggle. Good. 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 Any pain? Alright, good. Just press and wiggle. Press and wiggle. Good. Press and wiggle. Press and wiggle. Press and wiggle. Press and wiggle. Good. Alright, we're going to check out the other ear now. Same thing, just going to do a visual inspection, looking for anything that shouldn't be there, just gently palpating all the way around, Good, good. And now we're going to press and wiggle, 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 press and wiggle. Press and wiggle. Press and wiggle. Press and wiggle. Good. Any pain? Good. Now, I'm going to take my otoscope here. As you can see, it's kind of light, and I'm just going to gently slide it in your ear and take a look inside, alright? Alright, so you can close your eyes if you like. Just relax. I'm just going to gently slip the otoscope inside. Slip the otoscope vagus nerve is intact. Good. Good. Check out the other side. Alright, same thing, just gonna slip in slowly and take a look inside. Your canal looks nice and clean, good. And the back membrane looks very nice and pearly white. Very good. Well, the inside of your ears looks perfectly clean and healthy. So I just want to run a few hearing tests on you to make sure that everything is working perfectly and you can hear just fine. So these tests are going to require you to close your eyes. And for the first test, I am just going to whisper a word in one of your ears and I'd like you to repeat it back to me, alright? Alright. So just keep those eyes closed. Chocolate. Good. Coconut. Good. Tropical. Good. Sleep. Relax. Good. Dream. Very good. Alright, I want you to keep those eyes closed for me. And I'm going to make a sound in your ear, and it's going to move farther away. And then I want you to tell me when you can no longer hear it, alright? Alright, so here we go. Good. 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 Very good. Just need to make a note real quick. Alright, so I want to keep doing a few more hearing tests with you, if you'd be so kind. So what I'm going to do is I have some little fingertip sleeves here that make a very distinctive sound. And you can hear what it sounds like. Just like that. So what I'm going to do is close those eyes. And you let me know if you can hear it in that ear or that ear, okay? Alright. So keep those eyes closed for me. And you let me know which ear you can hear it in. Good. Good. Very good. Great. Yeah. Yep. Yes. Good. Very good. Alright. You can go ahead and open your eyes now. I have to say, I think your ears are perfectly fine. So now we're going to move on to your sense of sight. So this is going to involve multiple different tests, including an eye chart. I'm also going to be getting very, very close to you so that I can look inside your eye, okay? Would you like to do that part first? Some people like to just get it done and over with. That's fine, we can do that. So I'm just going to put my ophthalmoscope onto my light here. Make sure that's nice and secured. Turn that on. Test my light. So what I'm going to do is first I'm going to sit back and I'm going to ask you to look straight at me. Keep your eyes open and I'm going to observe you from a distance like this. Okay. Just keep that eye pointed at me. Good. 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 All right, same thing, and I'm going to look in your other eye. So just look straight at me. Good. Just keep looking right here at me. Good. So I'm going to have to get a little bit closer. Just going to put my hand on your head here. Get real close and look inside. Just looking for any kind of copper wiring, any kind of damage to the iris. Ocular nerve looks good. Why don't you go ahead and look up for me? Good. And down. Good. Left. And right. Good. That eye looks wonderful. I'm going to do the same thing over here. I'm just going to hold your head still real quick. I'm going to look inside. Look inside. Look inside. Good. And you have a perfectly intact ocular nerve, so why don't you go ahead and look up for me? Good. And down. Good. To the left. Good. And right. Good. All right. All done with that part. See, not so bad. But I do need to do a quick reflex test on your eye. So what I'm going to do is I'm going to take this cotton swab here, and I'm just going to pull out the tip a little bit to make a little wisp of cotton. Just the tiny, tiny, gentlest little wisp. And what I'm going to do is just brush it gently at the corner of your eye with you looking straight at me, just to test that eye reflex, like so. Good. And like so. Good. Simple, easy, painless. Now we are going to do a quick Snellen chart. So you can just read the letter I point to. Good, good, good. And how about this one? Good. And that one. Good. Great. Very simple, very easy. Have you ever seen Ichihara plates before? You might not know the name, but I'm sure you've seen something similar to this in the past. Yes, a color blindness test. So this is going to be very easy. You just tell me what you see. 8, very good. 6, very good. 15. Can you get it? That one gets some people sometimes. Here, look a little closer. 74. It's okay. Red-blue color blindness is very common. How about that one? Little trouble. And that one. 6, good. Let's see if we can find a fun one. How about that? 5, 7. Alright, well, I'm going to make a quick note because I think I might want to get you into an optometrist. Nothing serious. Color blindness is more common than you think for some degree in a lot of people, but it's better to know. So, in that regards, we will definitely put a note in your chart just for a referral visit. Nothing serious, but I'd like to at least keep checking your eye acuity. So I'd like you to just look straight at me, and I want you to follow my finger. Both eyes. Keep the head straight. Just follow my finger with both eyes. Good. 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 And now I want you to let me know when my fingers come into your vision and then out of your vision, okay? And here we go. Good. 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 Great. And good. Good. keep looking straight, straight, straight at me, and you let me know which fingers you see moving. Good, good, wonderful, fantastic, and spectacular. All right, great. And now I'd like you to tell me how many fingers I'm holding up when I flash them in front of your face, okay? All right, so here we go. Ready? 2, good. 3, good. 5, good. Good, good. Great. I have to say, it's a good thing that this is just a routine checkup because, frankly, I think you are perfectly healthy. All right. Well, now I'd like to do some light tracking tests with you and also check your pupillary response. So what I'm going to do is I'm just going to cover one of your eyes and I'm going to swing the light in and then out and then in, out, in, out, in, out, in, out. Very good. And we're going to do the other side. We're going to swing that light in and out, in, out, in, out, in, out, in, out, in, out. Great. Okay. So now I want you to look straight ahead, right at me, and just follow that light with your eyes. You just follow the light. Good. We're going to do the classic H pattern. Good. Okay. And now we're going to do a star. After we finish this H, so we're going to start here in the corner. Just going to go up, down. Then we're going to go across and then back down. And we have a star. So just keep following the light. Good. And now I'm going to cover one eye and you just keep following that light. Just follow. Good. You are doing great. Great job. Alright, just going to cover the other eye. It's going to come down good. Good. Wonderful. Alright, well, I have to say, I don't think there's a thing wrong with those eyes of yours. So we are going to move on to the final portion of the exam, which is the sensation portion. So for this, I'm going to first be checking your muscle reflexes in your face and also their reactions. And we're also going to take a look inside your mouth real quick. And then we will do our touch test, which is very relaxing and quite fun. Many patients enjoy it. So I want you to keep that head straight and look straight at me. And I'm just going to come over here. I'm just going to feel those shoulders of yours. All right, good, good. All right, and what I'm going to do is I'm going to press down on your shoulders. I want you to shrug them up, and I'm going to try to press them down. Don't let me press them down, okay? All right, here we go. 1, 2, 3. Don't let me press them down. Good. Don't let me press them down. Good. And don't let me press them down. Very good. All right, now I want you to drop your shoulders, and I'm going to just try to keep them down, and I want you to shrug them up, all right? 1, 2, 3. Come on, fight me. Good. 1, 2, 3. Fight me. Good. 1, 2, 3. Fight me. Good. Great. Do the same thing with your neck. I'm going to just place my hand on the side of your face. I'm going to try to push your face to one side, all right? So you resist. Ready? 1, 2, 3. Fight me, fight me, fight me. Good. One more time. 1, 2, 3. Fight me, fight me, fight me. Good. Do the other way. 1, 2, 3. Fight me, And one more time. 1, 2, 3. Fight me, fight me, fight me. Good. Great. Wonderful. Just going to examine your neck here. Good. And come feel under your jaw again. And this time I want you to clench your teeth. I'm going to feel right back here behind your jawbone. Just go ahead and clench, 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 clench. Good. Good. And swallow. Good. Just going to feel your lymph nodes here. Just look for any kinds of swelling, but I'm not seeing anything, so don't worry about that. Alright. Now, look straight at me. And go ahead and raise your eyebrows up like you're surprised. Good. Give me a big frown like you're mad. Good. And puff your cheeks out like this. And hold it. And I'm going to try to pop, 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 your cheeks, okay? And pop, 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 pop. Good. Alright. Well, I say your facial muscles are working perfectly. So now we're going to move on to the sensation exam. So for this portion, I'm going to ask you to close your eyes, and I'm going to either touch you with a dull object or a soft object on any part of your face or your neck, and you let me know which object it is, okay? So for reference, this con swab here is going to be the soft object, just like that. And this acupressure tool is going to be the dull object. Alright, and it feels like that. Okay? Alright, so go ahead and close those eyes for me, and we are just going to touch. Very good. Touch. Good. Touch. Good. Touch. Dull. Very good. Touch. Dull again. Touch. Dull. Nope. Soft. That was me. I'm sorry. Touch. Soft. Very good. Touch. Dull. Touch. Soft. Good. Touch. Dull. Touch. Soft. Touch. Dull. Good. Touch. Soft. Very good. You can open your eyes and you can blink, 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 because I'm going to ask you to close them again in a moment. And this time we are going to do another con swab here. This one's a little tighter. So this is going to be soft. And the brush here is going to be softer. Alright? And you let me know which one you can feel. So you can close those eyes for me and touch softer. Good. Touch soft. Touch softer. Touch soft. Touch soft. Touch softer. Very good. Touch soft. Touch softer. Touch soft. Touch softer. Touch soft. Touch softer. Wonderful. Well, go ahead and open your eyes. And that, my friend, is going to bring us to the end of today's exam. And I have very easy notes to take on you. You are perfectly healthy. But what I'd like you to do is I'd like you to go home today and take it easy and relax. You deserve it. Let's bring those stress levels down a little bit. And I want you to hydrate very well the rest of the day and plan on getting a very good night's sleep tonight, alright? And if you need anything, you know where to find us. We'll set you up with a recommendation for an optometry appointment just a checkup. But if you need us, you know where to find us. And we will see you again soon. Bye bye.